Thank you for watching the video. This is YouTube Medical University. Suddenly I have a shocking fact for all of you. Today, in Japan, 1 out of every 3 adults has fatty liver, even though they hardly drink or don't drink alcohol at all. That's the reality. When you hear fatty liver, don't you have the impression that it's a disease that affects people who like to drink or people who are overweight? Some people think they're fine just because their triglyceride levels are a little high in their health check results. But actually, it's quite common that when you get tested, you find out you have fatty liver. If you're someone who thinks, I'm probably fine, you might actually be at risk, so today's video is very important. Most non-drinkers with fatty liver have what's known as non-alcoholic fatty liver disease. It progresses quietly and silently, gradually damaging your liver. By the time you notice, your liver is already hardened from fatty liver. It progresses to cirrhosis, and cirrhosis greatly increases the risk of liver cancer. You could develop liver cancer and lose your life. There are actually quite a few people like that, but please don't lose hope after hearing this. Actually, if you improve your lifestyle habits at the stage of fatty liver, this fatty liver can return to a normal liver. But even if you say that, in the end, it's tough. You believe dieting is necessary for weight loss and returning to a normal weight, right? Actually, that's not always true. For example, if someone weighs 100 kilograms, there are reports that just reducing their weight by 7% to 93 kilograms can improve the condition of their liver cells. So that's what this video is about right from the start. What exactly is fatty liver, and why does it occur even in people who aren't overweight? I'll introduce ways to notice the warning signs from the silent organ, the liver. And in the second part, I'll explain the scientifically correct way to reduce fat from the liver. I'll present the most effective dietary methods, then discuss common topics in part 3. For example, questions like, if it's 100% fruit juice, it's good for the liver, right? Or, I think alcohol is bad for the liver, but if I take turmeric, can I prevent liver damage? I'll be answering these common questions. This video might end up being a bit long, but by the time you finish watching it, you'll know exactly what you should do from today, almost like you're a liver specialist yourself. The liver is the body's heaviest organ. I'll discuss this further soon, but it has many functions. The liver is a very important organ for protecting your future health. Please listen all the way to the end. So first, in the first part, what exactly is fatty liver? Is your liver okay? I'll introduce ways to notice the warning signs from your liver. Now, I have a question for everyone. Where is the liver located in the body? Maybe some of you think it's around the center of the body, or maybe on the left side, or was it on the right side? I think there are actually quite a lot of people who don't really know. Actually, the liver is an organ located on the right side of the body, protected under the ribs. Among the organs, it's quite heavy, and it's said that if you take out an adult's liver, it weighs about 1.5 kilograms. Because it's such an important organ, we have the word kanjin, essential. And just like the liver and kidneys, or the liver and heart, the liver is a very important organ. That's why this kanji character is used. So, can you answer what functions the liver has? Please pause the video and try answering in the comments section. For example, the heart pumps blood throughout the body. The kidneys, for example, have clear and well-known roles like producing urine, but actually the liver has all kinds of functions. It's said that the liver has more than 500 different functions. Among those, there are 3 especially important ones. Let's quickly cover those functions today. Please understand that the liver is like a huge chemical factory that works whether you're sleeping or exercising. A factory needs energy first, right? Actually, the food we eat is digested and absorbed as it passes through the stomach, duodenum, and small intestine. The nutrients absorbed from the intestines enter the bloodstream and are first delivered to the liver, which acts as a factory so they can be used by the body. They are then turned into energy, hormones, or proteins that become the building blocks for muscles. And if you eat too much, the nutrients that aren't needed right away or can't be used immediately are stored. Energy is converted into a form called glycogen, which is stored in the liver and muscles so it can be used when needed. But when there's so much that you can't store anymore, that's when it becomes a problem. What happens when energy is carried to the liver? The excess energy is converted into fat, and that fat accumulates in the liver as fatty liver. Yes, that's the beginning of fatty liver. What do you think? I think it's easier to understand when you consider the reasons, and the liver's functions don't stop there. Whether it's alcohol or medicine, the liver's role is also to detoxify harmful substances in the body. It turns harmful substances produced in the body into harmless ones. It acts like a filter. If this function declines, toxins can build up in the liver, which may cause you to lose consciousness, or medicines may become too effective and threaten your life. It can have various effects. And finally, the third function of the liver is that, as I mentioned earlier, the digested food gathers in the liver, but in the first place, it also produces digestive substances to help with digestion. The liver also secretes enzymes. It helps digest and absorb the fats we take in through our mouths. Actually, the liver produces a liquid called bile. This bile is stored in an organ called the gallbladder, and when we consume fat, the bile is released from the gallbladder to help digest and absorb the fat. Also, when we overeat in the first place, the liver also removes things like cholesterol from the body, which is another important function. The liver acts as the body's cleaner, which makes it easier to remember its role. In this way, the liver works for you 24 hours a day, even while you're sleeping. I think you now understand that it is a very important and high-spec factory. Here, let me answer a common question. As I mentioned at the beginning, fatty liver is actually quite common, even among people who don't drink alcohol. Why is that? As I mentioned earlier, fatty liver is when fat accumulates in the liver. It's a condition where fat itself accumulates in the liver. If more than 5% of the liver cells contain fat, fatty liver is the condition where fat builds up. In gourmet cuisine, there's something called foie gras, but that's actually also a liver with accumulated fat. In the past, fatty liver was thought to be caused by drinking too much alcohol. However, in recent years, that common belief has been overturned. Most cases of fatty liver in people who don't drink alcohol are called non-alcoholic fatty liver disease. Actually, non-alcoholic fatty liver disease is especially common among Japanese people. But in the end, it's just fatty liver, right? Every year I'm told I have fatty liver, but nothing really changes. And since it doesn't hurt or itch, I thought it was fine to just leave it alone. Actually, with non-alcoholic fatty liver disease, about 10 to 20% of people per year develop inflammation in the liver, meaning hepatitis occurs. That condition is called non-alcoholic steatohepatitis. The official name is non-alcoholic steatohepatitis, and it progresses to that condition. This means hepatitis or liver inflammation, like a constant fire in your liver. The liver cells are gradually being damaged little by little, and just like when you scrape your knee and it forms a scab and hardens, when liver cells are damaged, the body tries to repair them. In the process, the liver becomes hard and stiff, just like a scab, and this is called cirrhosis. Once the liver becomes hard and develops cirrhosis, it can no longer be improved. The function of the liver will sharply decline, and ultimately that leads to an increased risk of liver cancer. How do we detect fatty liver and address it? These are important questions. The liver can regenerate itself, which is why living donor liver transplants are possible. Even if part is removed, it grows back, similar to a lizard's tail. If a part is removed from the human body, it regenerates. There are actually very few organs like that, in that sense too. This organ, the liver, has a very high regenerative ability and is a very important organ. However, if it becomes cirrhotic and hard, it reaches a state where it can no longer regenerate. You understand how important it is to act while the liver is still healthy. You may wonder why fatty liver, despite being serious, is so hard to notice. The reason is that the liver is known as the silent organ. For you, it's just like having sand stuck to the bottom of your foot. You might notice it due to a strange feeling, but the liver is mysterious. Even if inflammation occurs and the liver cells keep dying off one after another, you don't really feel any pain. That's why there's only one clue you can rely on. That's what health checkups are for. When you get a blood test during a health checkup, have you ever seen values like aspartate aminotransferase or alanine aminotransferase or maybe aspartate aminotransferase or glutamate pyruvate transaminase? These values are enzymes found in the liver, and if these numbers are elevated, it's a sign that liver cells are being damaged for some reason. The ones I especially want you to pay attention to are the alanine aminotransferase or glutamate pyruvate transaminase values. If these values are over 30, it means your liver is crying out for help. That possibility rises a lot. Please review any recent health checkup results. Compare them and check your results. Don't assume you're fine and ignore it. If you feel even a little off, if you're concerned about your health checkup results, consult a liver specialist or your doctor. Tests for liver disorders are recommended. Tests can determine the cause, and ultrasound with gel on your abdomen can directly check for liver fat accumulation. I recommend an ultrasound to check if your liver is hard, which may indicate cirrhosis. An ultrasound or echo can help detect this. For people with fatty liver, the liver appears whiter and more glittery than a normal liver. This is a sign of fatty liver. So what did you think about the dangers of the liver? and I explained the methods for early detection of these conditions. Let me repeat, fatty liver is still a condition that can be improved. In the next session, I would like to explain the dietary techniques to improve this fatty liver that you've been waiting for. At YouTube Medical University, we share insights from a practicing physician to help you get healthier right away. We will keep providing important information clearly and responsibly. I'd appreciate it if you subscribe to the channel to catch all new videos. So in the second part, I will introduce the most effective and scientifically proven dietary methods to reduce fat from the liver. There is no miracle drug that will cure fatty liver just by taking it. Be especially cautious with health information that seems too good to be true. So what should you do? The important thing to improve fatty liver is actually simple. It's about losing weight, but that's not always the case. You don't have to aim for a normal weight like a body mass index of 22. There is data showing that just losing 7% of your current body weight can dramatically improve liver inflammation levels. If you weigh 70 kilograms, losing 5 is enough. If you weigh 100 kilograms, losing 7 is fine. Doesn't this seem like a hopeful number that you can work toward with a little effort? And while losing weight is important, eating habits are also important. If you practice the habits I'm about to talk about, you can do it without too much difficulty. And I believe you can improve fatty liver in a healthy way, so please listen to my top 5 strongest health habits. The 5 best health habits to reduce liver fat. The first one is to quit all sweet drinks. I think this is the most important lifestyle habit. Juice is the most efficient way to consume sugar. The juice you're drinking, or sports drinks, energy drinks, or cafe au lait. These sweet drinks themselves may be directly attacking your liver. The real danger is what's in these drinks. It's a type of sugar called fructose. When you hear fructose, you might think it's the sugar from fruit, so it sounds healthy, doesn't it? If you thought that, actually that's the trap. Like alcohol in drinks, fructose is in juice. It can actually be toxic to your liver. Think about it for a moment. Let's say you're making a cup of apple juice. To make that, you need about 2 to 3 apples. Apples. If you eat 2 or 3 apples as fruit, peeling them and all, it takes quite a bit of time, right? And you get pretty full, don't you? But all of that is included. But drinking a cup of apple juice is easy, isn't it? In other words, eating the fruit in its solid form, it will be digested. Since it also contains dietary fiber and vitamins, it's relatively healthy. However, once it becomes juice, the dietary fiber is removed and often the beneficial components like vitamins are also lost. And more than anything, because you can consume it as a drink in no time, it gets absorbed all at once, which puts a burden on your liver. The liver collects nutrients from the intestines and processes them gradually. However, consuming a large amount at once, such as with juice, when fructose comes directly to the liver like that, it's said that liver problems are more likely to occur at such times. Please imagine that the liver gets overwhelmed and can't handle it anymore, so fat starts to accumulate rapidly in the liver. So drinking sweet juice puts about the same burden on your liver as drinking alcohol. It's important to understand this. By drinking soft drinks that contain things like fructose, a study has shown that the risk of developing non-alcoholic fatty liver disease clearly increases. Even more surprising, another study found that consuming the same amount of fructose slowly and gradually, the results showed liver damage differed greatly between gradual intake and consuming it all at once. As you can imagine, the conclusion was that consuming it all at once caused more damage to the liver. In other words, it's the speed that becomes toxic. I think many people might find this surprising. Drinking juice, if you feel like you can't give up the pleasure of drinking juice, even just 1 cup a day is fine. But try replacing that 1 cup of juice with tea or water, or if you do drink juice, don't drink it all at once. Drink it little by little in small portions. That's all you need to do. But by doing this, you might be helping to take care of your liver. Lose fat from your liver. Here is the second of the top 5 strongest health habits. Do 10 minutes of strength training a day. After all, exercise is important. What about exercise? While building endurance matters, I'm specifically recommending strength training this time. Try to be conscious about increasing your muscle mass. In fact, increasing muscle itself is considered to be very good for fatty liver. If you think about the reason, it's easy to understand. The nutrients we take in through our mouths are stored as glycogen if they're in excess, and this glycogen is stored. The places where it's stored are the liver and the muscles. People with less muscle can't store much glycogen in their muscles, so the liver takes on more of the load and converts it to fat. This may make fatty liver more likely. To prevent fatty liver progression, it's important to build muscle so that energy can be stored in the muscles. Even if you're not overweight, having little muscle means there's less space to store energy, causing it to build up in the liver. That's why it's thought that even thin people can get fatty liver. In other words, building up muscle, which acts as a tank to store energy, helps reduce the burden on your liver. While watching this video, some of you may be lying down, sitting or standing. If you're healthy, try lifting your toes and heels while watching YouTube for leg muscle training. Even if it's just for the first 10 minutes of this video, try to be conscious about doing some exercise. For those who are working, instead of using the elevator, try taking the stairs once in a while. Get off one station early and walk to work, or add some exercise to your daily routine instead of overexerting yourself suddenly. Be mindful of moving more each day. The third of the 5 top healthy habits for reducing liver fat is to build a barrier with dietary fiber. As I mentioned in the first point, having sugar rush into your system all at once puts a burden on your liver. To prevent that, on the other hand, taking dietary fiber together slows down and eases absorption, which reduces the burden on your liver. So instead of drinking fruit as juice, just eating it as it is can make a difference. It's not only your liver that's affected when absorption occurs all at once. Your blood sugar level will also spike rapidly. This is called a blood sugar spike, and it means your blood sugar rises quickly. Just that alone is actually thought to promote the progression of arteriosclerosis in your blood vessels. So, to protect your liver and to protect all the blood vessels in your body, it's very important to prevent your body from absorbing sugar all at once in order to protect yourself from future strokes or heart attacks. In fact, when I see patients with fatty liver in outpatient clinics and ask about their eating habits, there are actually a lot of people who are lacking in dietary fiber. What I usually recommend to those people is to always start their meals with vegetables or mushrooms. And I ask them to eat seaweed as well. This is called a veggie first. For example, even when eating a set meal at a restaurant, I suggest starting with miso soup or shredded cabbage or similar vegetables even at convenience stores. Try not to forget to buy vegetables and make sure to eat the vegetables first. Try your best to add one more serving of vegetables to your regular meals whenever possible, and make sure to chew well and eat slowly. If you eat while doing something else or eat quickly, your blood sugar will spike all at once and you won't feel satisfied, which can lead to overeating. Just focus on chewing well, concentrate on your meal, savor your food, eat with gratitude, and if possible, start with vegetables. However, this will greatly affect your liver, so please keep that in mind. Please try it. Among these, what I personally practice is making sure to get soluble dietary fiber, especially sticky, viscous, fiber-rich vegetables. For example, inexpensive and easy to increase seaweeds like wakame or sticky foods like okra and toro makabu. Please try to consciously include these vegetables and seaweeds in your diet. These are called soluble dietary fibers, which are a type of dietary fiber that dissolves easily in water. They become food for the gut bacteria, help improve the intestinal environment, and make the stool softer so that it can be passed smoothly. It can help regulate your digestive system and has various other benefits as well. Why not try eating sticky vegetables in your daily meals? They can help reduce fat from the liver. Here's the fourth of the 5 strongest health habits. Your staple food portions should be about the size of your fist. Now, up to this point, we've been strengthening our muscles as a kind of tank. And I've talked about building a barrier with dietary fiber. And what's important is, in the end, it's about controlling the amount of sugar in your staple foods. When you all eat your meals, which are carbohydrates, which are proteins, and which are fats. And are you aware of which ones are vegetables? In the end, consuming too much sugar is also a cause of fatty liver. However, when you actually look at the diets of people with fatty liver, it's often like carbohydrates plus more carbohydrates. Many people have similar meal plans, like always having rice at the table. And then there are noodles, and maybe root vegetables like sweet potatoes or potatoes. All of these are carbohydrates, so if you eat too many carbs, like eating white rice along with ramen, you end up consuming too many carbohydrates. This can lead to weight gain and cause fatty liver. So it's important to review your meals and try to have only one type of carbohydrate per meal. If you eat them, limit to about one fist and stay mindful. Since it's about the size of a fist, try to keep your rice serving to that amount, even in a bowl. A fist-sized piece of bread is roughly one slice from a loaf cut into 6 pieces. It also depends on your size and consumption. Energy needs vary by age, but recent weight gain likely means you're eating more carbs than you realize. Pay attention to how many fist-sized portions you eat. If you still feel hungry afterward, then instead of getting your calories from carbohydrates, try to get them from protein. Make a conscious effort to get enough protein. In fact, getting enough protein is said to help control your appetite and prevent overeating. Instead of increasing your rice, just add things like tofu or natto. Simply add more protein-rich foods to your regular meals. But I think you'll notice a difference, so please try to be conscious of it. Remove fat from your liver. Here is the 5th of the top 5 healthiest habits. Let's restore your liver with 7 hours of sleep. The last habit might come as a surprise, but actually it's sleep. When you don't get enough sleep, don't you find yourself wanting to snack more? This is due to lack of sleep. That's because it increases a hormone called ghrelin, which stimulates your appetite, and decreases a hormone called leptin, which suppresses your appetite. In other words, when you don't get enough sleep, regardless of your willpower, you end up giving in to your desires and overeating. And above all, during sleep, growth hormones are secreted. This hormone is very important for repairing damage throughout the body. The liver has the ability to regenerate, and it is believed that the repair of the liver also takes place while you are sleeping. So, everyone, please take a look at your own sleep time, and first check if you are getting about 7 hours of sleep. Just staring at your smartphone's blue light. Your sleep phase shifts later and gets delayed, so if you use your smartphone, please enable blue light filter settings. It's important to start taking measures with what you can do. How was it? I introduced 5 scientifically proven healthy eating methods to reduce fat from your liver. I've previously made videos about exercise, protein, and sleep. I've also uploaded them on YouTube Medical University, so if you're interested, please check them out from the description after you finish watching this video. As I mentioned, if you find this helpful or interesting, I'll keep sharing useful information from a doctor's perspective in a simple way. Please consider subscribing if you enjoy the channel. I would really appreciate it. Now finally, in the third part, I'll talk about the truths and myths regarding fatty liver. I would like to deepen your understanding of fatty liver by addressing 3 common questions and answering them. The first question. Earlier, you mentioned that fruit juice is not good, but if it's 100% fruit juice or 100% vegetable juice, is it okay? Unfortunately, the answer is no. This is a point that many people misunderstand, but even if it's 100%, once it becomes juice, you can drink it all at once, right? That's the problem. So, just because it's 100% doesn't mean it's okay. And even if it says 100% fruit juice or no added sugar on the label, ultimately the dietary fiber is removed, making it easier to absorb even the beneficial parts. There are also quite a few cases where things like vitamins have been stripped away as well. And in most cases, sugar and other ingredients are added to vegetable juice to make it easier to drink. Check the ingredients list on the back. You'll see it has about the same calories as regular juice. There are many kinds of vegetable juice, but I recommend eating fruits and vegetables themselves, not as juice. Please try to eat them as they are. It's important to slowly eat them together with the dietary fiber, peeling the skin or removing the stems as needed, so please keep that in mind. Second, some people say, I'm thin, so there's no way I have fatty liver, right? But that's not always the case. I also see patients in my clinic, and there are definitely some people who are thin but still have fatty liver. I mentioned the reason for this earlier, right? For many people, it's the decrease in muscle mass that has an effect. It's possible. Please everyone, try making a circle with your index finger and thumb and put it around your calf. Use the calf of the leg that is not your dominant leg. If your index finger and thumb overlap or there's extra space even at the thickest part of your calf, you might have decreased muscle strength. If your fingers just touch or can't meet, your muscle is relatively well maintained. Please let me know how it was for you in the comments section. This will help others too. Now the next topic. Question 3. If you take turmeric before drinking alcohol, it will protect your liver, right? This is also a common misconception, but the answer is no. In fact, the idea that turmeric is good for your liver. There is little medical evidence for this, and you should understand that it could even have the opposite effect. In a study conducted in Japan, supplements and other health foods were identified as causes of liver damage. Turmeric was reportedly the most common cause, highlighting its significance due to a specific component it contains: iron, especially for those with liver issues. It is thought that it could put even more strain on people with existing liver problems, so taking turmeric because your liver is bad can actually have the opposite effect. If you have liver problems, the correct understanding is that you should be careful not to take too much turmeric. Please make sure to understand this correctly. Please keep this in mind. How was it? This time we talked about how your liver can be damaged even if you don't drink alcohol. 1 in 3 Japanese people gets this condition. We talked about everything related to fatty liver, such as what fatty liver is, why it can develop even if you don't drink alcohol, and how if you leave fatty liver untreated, inflammation can occur in the liver, making it hard and increasing the risk of liver cancer. Fatty liver can be improved, right? We introduced 5 scientifically proven healthy habits that we want you to try. If you forgot what was introduced, please rewind the video and review it at your own pace. And if you thought, I want to try this, or if you already have experience improving your fatty liver by doing something like this, please feel free to share it in the comments. I think it will be helpful for others. And even just making a note like 7% of your body weight is fine, so please leave a memo in the comments. When you review the video, even doing one action like this helps you remember better. At YouTube Medical University, we'll keep sharing easy to understand videos from a doctor's perspective. Let us know your requests in the comments and remember to like or dislike. Either is fine, but rating the video will help us improve future videos.